Stop what you are doing right now, because what I am about to share could be the most important thing you hear this year. My grandmother came to me 4 years ago complaining about being tired, always hungry, gaining weight around her middle even though she had not changed a single thing about how she ate. She was sharp as a tack, stubborn as a mule, and convinced it was just getting older. I sat across from her at my kitchen table, and even with 22 years in internal medicine, I almost missed it. I almost sent her home with the same thing every doctor before me had told her: nothing is wrong. Your blood sugar is normal. Keep doing what you are doing. But I ran one extra test. One test that almost no doctor orders anymore. And what came back changed everything I knew about how we treat millions of people over 60 who are silently walking toward catastrophe right now. 62%. That is the number that keeps me up at night. A major analysis out of Johns Hopkins University found that 62% of adults over 60 have measurable insulin resistance right now. And of those, less than 12% have been told. Think about that. More than half of the people sitting in front of their televisions tonight, taking their blood pressure medication, doing everything their doctor told them, are quietly developing a condition that doubles your risk of heart attack, triples your risk of dementia, and can steal years from your life. And their blood sugar looks completely normal every single time. That is not a failure of the patient. That is a failure of the system. A system that tests for the wrong thing at the wrong time and sends you home with false reassurance while the real damage builds. My name is Dr. Catherine Wells. I have spent over 2 decades as an internist, and the last 8 years focused specifically on metabolic health in older adults. I have treated over 14,000 patients, and I want to be honest with you right now. The way I was never allowed to be in a 7-minute appointment, the standard of care for catching insulin resistance in this country is broken. Not because the doctors are bad. The doctors are doing exactly what the system trained them to do, but the system was designed around managing disease, not preventing it. And by the time insulin resistance shows up on a standard blood test, it has usually been developing quietly inside your body for 10 to 15 years. 10 to 15 years of damage before a single warning light comes on. That ends today. Because I am going to walk you through 12 warning signs that appear long before any blood test catches them. Signs your body is giving you right now. Signs most doctors are never trained to connect. And I am going to show you a test you can actually order yourself, one that gives you a real picture of what is happening inside your cells, not what happened after the damage was already done. Before we go any further, I want to tell you something important. You are not here by accident. People who watch videos like this, people who want to understand the why, not just take the pill and move on, those people change outcomes. So, if you want more of this kind of deep, honest information, subscribe to this channel. I put out new content every single week. And this week specifically, stay until the very end because I am going to reveal the one test that changed my grandmother's life, and it might change yours. What country are you watching from right now? Drop it in the comments below. I love knowing who is in this community. Now, let me explain what insulin resistance actually is, because the way most people understand it is completely backwards. Think about every cell in your body as a locked house. Your bloodstream is the street outside. When you eat, glucose, which is essentially fuel, moves through that street. Your pancreas releases a hormone called insulin, and insulin is the key. It goes door to door, unlocking each house so glucose can get inside and be burned as energy. That is how it is supposed to work. Clean, efficient, beautiful. But here's what happens after decades of the modern diet. After years of processed food and refined sugar and carbohydrates that spike your blood sugar 30 times a day, the locks start to jam. The doors stop responding. Insulin keeps knocking louder and louder, but fewer and fewer doors open. So your pancreas panics and pumps out even more insulin, trying to force the locks open. And for a while it works. Your blood sugar stays normal because your pancreas is basically working overtime, screaming at the doors. But here is the thing nobody tells you. The blood sugar test your doctor runs every year only tells you whether the street is flooded. It does not tell you how hard the locks are jamming. It does not tell you how desperately the keys are working just to keep up. For years, Sometimes over a decade, you can have perfectly normal blood sugar while insulin resistance is quietly destroying the lining of your blood vessels, inflaming your liver, clouding your thinking, and wrapping fat around your organs. The moment your blood sugar finally rises on a test, the moment your doctor says your numbers are a little high, the locks have already been jammed for years. That is not a warning sign. That is the system finally catching what was already a long time coming. A landmark paper published in the journal Diabetes Care in 2019 followed over 4,000 adults without diabetes for 12 years. Researchers found that insulin resistance caused measurable damage to blood vessel walls, an average of 11 years before any glucose abnormality appeared on standard testing. 11 years of silent damage. While blood tests said everything was fine, this is the information that falls through the cracks in a 7-minute appointment. Not because your doctor wants to hide it, but because the system never built the infrastructure to catch it. Let me tell you about Sandra. She represents a pattern I have seen dozens of times in my practice. Sandra is 67 years old. She spent 31 years delivering mail in a small town in Virginia, and she is proud of every one of those years. She raised 3 kids, she is close with her grandchildren, and until a few years ago, she was walking 6 miles a day just doing her job. But after retirement, things started to shift. Slowly at first, then all at once. And the 12 signs I am about to share with you, Sandra had 9 of them, and every single annual physical said she was fine. Warning sign number 1. You are hungry again less than 2 hours after eating a full meal. Not a little peckish, actually hungry. That grabbing feeling in your stomach, the need for something now. Sandra described it to me this way. She said, I eat breakfast at 7 in the morning, a full breakfast, eggs and toast and coffee, and by 9 I am standing in front of the refrigerator again. She had lived with this for so long, she thought it was just how her body worked. But here is what is actually happening inside you when this pattern repeats every day. When you eat, especially anything with refined carbohydrates, and let us be honest, most of what the American food system puts in front of us is refined carbohydrates. Your blood sugar rises sharply. Your pancreas fires out a large burst of insulin to manage that rise. But if your cells are resisting insulin, that glucose cannot get inside efficiently. So your blood sugar drops fast, sometimes lower than where it started. Your brain reads that drop as an emergency signal, and it sends you right back to the kitchen. This is not a willpower problem. This is not weakness or a lack of discipline. This is your cells failing to respond to the key that is supposed to let them in. If this sounds like you, I need you to really hear this. It is not your fault. You have not been eating wrong. You have been running a system that is slowly breaking under the surface. Warning sign number 2. Compulsive cravings for bread, sugar, crackers, anything starchy or sweet, and you cannot seem to shake them no matter what you try. Now, I am not talking about wanting a cookie after dinner. I am talking about cravings that feel almost physical, like your body is demanding them, like you have no real choice. Sandra told me she would eat a meal, feel fine for an hour, and then the craving for something sweet would come on so strong she could not think about anything else. She had started hiding candy bars in her nightstand because she was embarrassed. The biology driving this is the same unstable blood sugar we just talked about. When your glucose is yo-yoing up and down all day because your cells cannot absorb it properly, your brain keeps demanding the fastest fuel it knows. And the fastest fuel available is always sugar, always carbohydrates. So the cravings reinforce the very cycle that is driving the resistance deeper. You eat sugar, insulin spikes, cells resist, blood sugar drops. Brain demands more sugar. Around and around. A 2021 review in the journal Frontiers in Endocrinology confirmed that people with measurable insulin resistance show significantly higher frequency of carbohydrate cravings, particularly in the hours following meals. Not because they lack discipline, because their metabolic signaling is broken in a specific and measurable way. Here is what I need you to sit with for a moment. If you have been fighting cravings for years, feeling like you cannot control yourself around certain foods, feeling guilty about it, I want you to understand something. You were not failing. Your biology was sending you a distress signal that nobody taught you to read. Warning sign number 3. You crash hard after lunch. You hit a wall around 2 in the afternoon. You need coffee or something sweet just to get through the rest of the day. This one is so common that we have normalized it. We call it the afternoon slump. We call it just being tired, but it is not normal. And it is not just being tired. Sandra told me the afternoon crash started about a year after she retired. At first, she thought it was the adjustment to not working. But 3 years later, she was taking a nap every single day and she still woke up groggy. She would drink 2 cups of coffee by 3 in the afternoon and still struggle to keep her eyes open. What is happening in your body during that crash is this. Insulin surges after your midday meal, especially if that meal was heavy in carbohydrates. Your blood sugar spikes, then drops, and as it drops, your body loses access to fast fuel, your brain goes from high alert to dim, your muscles feel heavy, your eyes want to close. The afternoon crash is not laziness. It is a metabolic event. It is your body telling you that your fuel delivery system is compromised. Warning sign number 4, brain fog. Difficulty concentrating, especially after meals. Feeling mentally sluggish, like you are thinking through cotton. Your brain is the most metabolically demanding organ in your body. It uses 20% of all the glucose you consume, but it needs that glucose delivered in a steady, consistent stream, not a flood and a drought, not a spike and a crash, a steady flow. When insulin resistance disrupts that delivery system, your brain feels it almost immediately. Cloudy thinking, trouble finding words, forgetting what you walked into a room to do, difficulty following conversations that would have been easy 5 years ago. Here is the part that stopped me cold the first time I read it. Researchers at Johns Hopkins have been studying the connection between chronic insulin resistance and Alzheimer's disease for over a decade. What they found is so significant that some neurologists have started calling Alzheimer's disease type 3 diabetes. The same resistance that jams the locks in your muscles and your fat tissue eventually jams the locks in your brain cells too. Neurons that cannot take up glucose die. They die slowly. And the damage begins years before any memory test catches it. I am not telling you this to frighten you. I am telling you this because the window to act is now, not after the blood sugar rises, not after the diagnosis, now, while your brain is still fighting back. Now I need you to stay with me because what I am about to share next is where this gets personal. These are the signs that are visible, signs you can check right now, signs that most people have walked around with for years, never connecting them to what is quietly happening in their metabolism. And when Sandra heard this part of our conversation, she got very quiet because she recognized herself in almost every word. If this information is helping you understand your own body in a new way, hit the like button right now. It sends this video to someone who needs it. Someone whose doctor may have already told them everything is fine. Warning sign number 5. Your waist is getting bigger even when the number on the scale barely moves. This is one of the most reliable early signs in my clinical experience. And it is one of the most overlooked because people focus on overall weight rather than where weight is accumulating. Sandra had actually lost 4 pounds in the year before she came to see me. She felt proud of that. But her jeans were tighter around the middle. She told me she thought the dryer was shrinking them. Let me explain what is actually happening. There are 2 types of body fat. There is subcutaneous fat, the fat you can pinch under the skin. And there is visceral fat, the fat that accumulates deep inside your abdomen, packed around your liver, your intestines, your kidneys, and your heart. Visceral fat is not passive. It is metabolically active. It releases inflammatory chemicals around the clock. It pumps out hormones that make insulin resistance worse. It is like having a small factory inside your belly that is continuously poisoning your metabolic environment. And insulin resistance accelerates visceral fat accumulation in a very specific way. When insulin levels are chronically elevated, your body shifts into fat storage mode, not just any fat, visceral fat preferentially. So your arms might stay the same, your face might look the same, but the waist creeps outward year by year. While standard blood tests say nothing is wrong, a simple way to check your own risk right now. Measure your waist at the level of your belly button. Then measure your height. Divide your waist measurement by your height. If that number is above 0.5, research consistently links that ratio to elevated metabolic risk. That ratio is a better early predictor of insulin resistance than your blood sugar. And almost no one ever tells their patients to check it. Warning sign number 6. You are doing everything right, eating better, exercising more, yet the weight will not move. And it is not because you are not trying hard enough. This one breaks my heart because the people who come to me with this complaint have usually been fighting for years. They have tried every diet, they walk every morning, they cut out dessert, and the scale does not move. Or it moves a pound or two and then climbs right back. And because the system never explains why, they blame themselves. Here is the real reason. Insulin is a fat storage hormone. When insulin levels are chronically elevated because your cells are resisting it, your body is constantly receiving a signal that says, store this, do not burn it. Between meals, when your insulin should drop and your body should start pulling energy from fat reserves, that drop does not happen cleanly. So fat stays locked up, unavailable. You are essentially trying to drain a bathtub while the faucet is still running full blast. This is not your fault, and it is not a mystery. It is basic endocrinology that the system simply does not have time to explain in a standard appointment. A 2022 study in the journal Obesity found that people with confirmed insulin resistance lost 63% less body fat over a 12-week calorie restriction protocol compared to insulin-sensitive individuals. Eating the exact same calories and doing the exact same exercise, same food, same movement, dramatically different results. Because the hormone environment was fundamentally different. Warning sign number 7, you have skin tags. Small, soft growths of skin, particularly around your neck or your armpits. Most people have been told these are harmless and cosmetic. And on their own, one or two of them, they are. But if you have multiple skin tags, especially appearing in clusters around the neck, armpits, or groin, there is a specific biological reason they are there. Insulin at high levels acts as a growth factor. It signals certain skin cells, particularly the ones called fibroblasts, to proliferate, to divide, and grow. Multiple skin tags appearing together are a visible marker that insulin levels have been elevated for a long period of time. A dermatologist or physician trained to look for this would see it as a flag, not a cosmetic nuisance. Sandra had 3 skin tags on her neck. She had had them for 6 years. 3 different doctors had told her they were nothing. And they were right that the skin tags themselves were benign. But what those doctors did not connect was what the skin tags were telling them about what was happening underneath. Warning sign number 8. Dark, slightly thickened patches of skin, usually around the back of the neck, the armpits, or skin folds that look like a shadow you cannot wash off. This condition has a medical name. It is called acanthosis nigricans. And unlike skin tags, which are common enough that doctors sometimes dismiss them, acanthosis nigricans is considered a classic clinical sign of significant insulin resistance. Medical students are explicitly taught to look for it, but it still gets missed in routine appointments. What causes it is this. When insulin levels are chronically high, they stimulate the pigment-producing cells in your skin, called melanocytes. These cells produce excess melanin in response. The result is darkening, thickening, and sometimes a velvety texture in the affected areas. People often describe it as looking like a dirty neck or a tan that will not wash off. Now I want to come back to Sandra for a moment, because here is where her story takes a turn. Sandra came to see me because her daughter had watched one of my earlier videos and insisted. Sandra herself was skeptical. She had been to 5 doctors in 3 years. Every one of them had run a blood glucose test. Every one of them had said her numbers were normal. She showed up in my office with a thick folder of results and a look on her face that said, "I hope you are different, but I have been disappointed before." I sat with her for 45 minutes. I asked about every symptom I just shared with you. The hunger, the cravings, the afternoon crashes, the brain fog, the expanding waistline despite eating less, the skin tags. The dark patch on the back of her neck she had been moisturizing for years trying to get rid of. She answered yes to 8 of the 12 signs I am going through today. And then I told her the same thing I am about to tell you. None of this is random. These are not coincidences. Your body is speaking in a consistent language, and the system has not been listening. I ordered her one test that most primary care offices do not include in a standard panel. And when the results came back, everything made sense. But I am going to hold that part of the story until we get through the rest of these signs, because I want you to have the full picture before we talk solutions. Because understanding the problem is what makes the solution actually stick. Warning sign number 9. Your blood pressure has been creeping up, even though you are not eating more salt, not drinking more, not doing anything differently. Most people think high blood pressure is a separate problem from blood sugar, a heart problem, a kidneys problem, something to manage with a different pill in a different category. But insulin resistance and hypertension are so deeply connected that seeing one should almost always make your doctor look for the other. And in my experience, they rarely do. Here is the mechanism. Chronically elevated insulin tells your kidneys to hold on to sodium. More sodium in the bloodstream pulls more water with it. More water in the bloodstream means more volume. More volume means higher pressure. At the same time, high insulin levels directly stiffen the walls of your blood vessels, making them less flexible, less able to expand and contract with each heartbeat. And as a third mechanism, high insulin activates your sympathetic nervous system, the fight or flight system, which constricts blood vessels and drives pressure up even further. 3 separate pathways, all pointing in the same direction, all driven by the same underlying insulin resistance that your blood sugar test is missing. If your doctor has recently put you on blood pressure medication or told you your pressure is on the higher end of normal, that is a metabolic signal worth investigating, not just managing with a pill. Now, before I continue, I need to be absolutely clear about something. If you are already taking blood pressure medication, do not stop taking it. Do not adjust the dose. Do not make any medication changes without talking to your physician first. What I am sharing with you is information to bring to that conversation, not to replace it. Warning sign number 10. Your blood work shows high triglycerides and low HDL cholesterol, even if your total cholesterol looks acceptable. This combination, high triglycerides paired with low HDL, is what metabolic medicine researchers call the lipid signature of insulin resistance. It shows up years, sometimes many years, before blood sugar ever rises. And it is routinely overlooked because doctors and patients are conditioned to focus on total cholesterol and LDL, the so-called bad cholesterol. Here is what is actually happening. When your cells are resisting insulin and cannot take up glucose properly, your liver steps in to handle the overflow. It converts that excess glucose into triglycerides and releases them into the bloodstream. At the same time, HDL, which functions like a cleanup crew for your blood vessels, drops. So you end up with more debris floating in the blood and fewer cleanup workers to clear it. If you have had blood work in the last year or two, pull it out right now. Look at your triglycerides. If they are above 150 milligrams per deciliter, that is a yellow flag. If they are above 200, that is a red flag. Now look at your HDL. If it is below 50 for women or below 40 for men, that pairing is a textbook early marker of metabolic dysfunction that your blood sugar is probably not showing yet. A 2020 study in the journal Atherosclerosis tracked nearly 6,000 adults without diabetes for 8 years. Those with the high triglycerides and low HDL pattern at baseline were 2.3 times more likely to develop insulin resistance before their blood sugar ever became abnormal. 2.3 times. While their blood glucose looked completely fine. Ask yourself, has your doctor ever looked at those two numbers together and connected them to your metabolic risk? Or were you just told to watch your cholesterol? Warning sign number 11. Your doctor recently told you your blood sugar is a little high, or your HbA1c is in the pre-diabetes range, and then said, we will keep an eye on it. I want to talk directly to you if this has happened. Because the phrase, we will keep an eye on it, may be the most dangerous sentence in modern medicine. Pre-diabetes is not almost a problem. It is not a near miss. It is the moment your body's compensating system has started to fail. It is the moment the dam begins to crack. And the damage did not start at that appointment. It started years ago. Think back to the dam analogy I used earlier. For years, your pancreas has been working overtime, pumping out more and more insulin to compensate for resistant cells. Your blood sugar stayed normal because of that incredible effort. The moment your fasting glucose rises above 100 or your HbA1c climbs above 5.7, it means the compensation is breaking down. It means your pancreas has been under that strain long enough that it is finally starting to lose the battle. And here is what makes this so urgent. Prediabetes is one of the most reversible points on this entire spectrum. The window is open, but it closes. Every year it is left unaddressed. The damage compounds. Nerve damage progresses. Blood vessel damage accelerates. Pancreatic cells that produce insulin begin to burn out. The reversibility that is available to you today shrinks year by year. If a doctor has told you your numbers are a little high and sent you home without a specific plan, please do not accept that. Ask directly what specific changes, what tests, what timeline, and what threshold will change the treatment approach. You deserve a real answer. Warning sign number 12, fatty liver disease. And the reason this one is last is not because it is the least important. It is because by the time your body is showing you fatty liver disease, you are looking at the result of insulin resistance that has been running for a very long time. Here is what happens. When your cells chronically refuse to take up glucose, the liver becomes the glucose disposal site of last resort. It takes in the overflow and converts it into fat. And that fat does not leave. It accumulates inside the liver cells themselves. Over years, the fat builds up, the liver begins to swell. And if it progresses, that fat triggers inflammation, which leads to scarring, which is called fibrosis, which can eventually progress to cirrhosis, liver failure, a condition that can and does kill people. What makes this so dangerous is that fatty liver disease is almost completely silent until it is advanced. The liver has no pain receptors. It cannot tell you it is struggling. The only early signals are sometimes mildly elevated liver enzymes on a blood test, numbers that get flagged as slightly off and then monitored and then forgotten. If you have ever been told your liver enzymes are just a little high but not to worry about it, that is worth revisiting. Now, here is what I need you to understand as we come to the part of this conversation that actually matters most. Every single one of these 12 signs is your body speaking. Your body is not betraying you. It is not broken. It is not simply aging. It is trying to communicate that something fundamental has shifted in how your cells respond to insulin. And it has been trying to communicate that for years, possibly decades, through signals that the system was never designed to hear. But you can hear them now, and that changes everything. Let me come back to Sandra. When her fasting insulin results came back, her level was 31 microneats per milliliter. Now, most people have never seen their fasting insulin number. Most labs do not include it in a standard panel. But for reference, optimal fasting insulin for metabolic health is below 7. Pre-diabetic range begins around 12 to 15. Sandra was at 31 with normal blood glucose. Every standard test said she was fine. Her insulin was screaming. I explained to her what this meant. I told her the same things I have been telling you. I said, Sandra, your body has been working incredibly hard for a very long time. Your pancreas has been compensating for resistant cells by pushing out more and more insulin. The blood sugar stayed normal because of that effort. But the cost of that effort is visible in every symptom you have described to me. The weight that will not move, the fog, the crashes, the hunger, the waist, the skin, all of it is connected. She sat very still for a moment. And then she said, so it is not in my head. I said, no, it is not in your head at all. Your body has been showing you real signs. The system just was not looking at the right thing. Here is what Sandra and I worked on together. And I want to be clear that these are not miracle cures. They are strategies with real scientific backing that can begin moving insulin sensitivity in the right direction. But they require consistency, and they require your physician to be part of the conversation. The first change we made was radical only in how simple it sounds. Every meal, every single meal, had to start with protein and fiber before any carbohydrates touched her plate. Not no carbohydrates, not elimination, just order. Protein first, vegetables first, carbohydrates last. Research published in the journal Diabetes Care in 2023 found that simply changing the sequence of eating protein before carbohydrates reduced post-meal insulin spikes by as much as 47% in adults with insulin resistance. Same food, different order, dramatically different insulin response. The second change required 10 minutes of her time after every meal. Not a gym, not a workout, a walk. Around the block, down the hallway, to the mailbox, and back. When your muscles contract during movement, even gentle movement, they can take up glucose from the bloodstream independently of insulin. They use a separate pathway. So a 10-minute walk after meals is essentially like opening a back door in those locked houses I described earlier, bypassing the jammed locks entirely. Sandra did both of these things consistently for 3 weeks before we added anything else. And I want to give you realistic expectations here, because this is the part most people never tell you. Week 1 will be uncomfortable. Your body has been running on sugar spikes and crashes for years. Changing the metabolic pattern creates real withdrawal symptoms, headaches, irritability, more intense cravings for about 72 hours. Most people quit during this window. They interpret the discomfort as the changes not working. But here is the truth. The discomfort is proof it is working. It is your metabolism beginning to shift. Week 2. Most people notice the afternoon crashes becoming less severe. The cravings ease slightly. Sleep often begins to improve. Not dramatically, but measurably. Week 3 is when I see the first real shift in my patients. This is the week they call me and say, I feel different. Not better in a dramatic way. Different, clearer, less pulled, more in control of what they reach for in the kitchen. By week 4, if they have been consistent, many patients begin to see measurable changes in fasting, insulin levels, in triglycerides, in blood pressure. Not because a pill fixed it, because the underlying signals started to change. Sandra called me on a Thursday in week 4. She said, I woke up this morning and I was not hungry for 2 hours after breakfast. 2 hours. That sounds so small. But for someone who had been raiding the refrigerator by 9 in the morning for 4 years, it was monumental. Her daughter texted me the next day. She said, whatever you told my mother, she is herself again. That is what this is about. Not a number on a test. A person getting themselves back. Now, the test I mentioned at the beginning, the one that changed my grandmother's life and Sandra's and the lives of dozens of my patients. Most doctors order a fasting glucose or an HbA1c. Both of these measure glucose. Neither one measures insulin. Asking your doctor to add a fasting insulin test to your next blood draw gives you the other half of the picture. If your fasting insulin is elevated while your blood sugar still looks normal, you are looking at early insulin resistance that has not yet cracked the surface of standard testing. You can take it one step further with a calculation called HOMA-IR, which stands for Homeostatic Model Assessment of Insulin Resistance. Your doctor can calculate it using your fasting insulin and fasting glucose together. A score above 2.5 is considered elevated. A score above 3.5 indicates significant resistance. And this calculation is available right now for anyone who asks for it, using tests that already exist in standard labs. You can also search for private labs in your area that offer fasting insulin panels directly. Now, I need to be absolutely clear about safety before I close. If you are currently taking medication for diabetes, including metformin, insulin injections, or any other glucose-lowering medication, do not change your doses based on anything in this video. Dietary and lifestyle changes that improve insulin sensitivity can lower your blood sugar significantly. If you are on medication and your blood sugar drops too low, that is a medical emergency. Any changes you make need to be supervised by your physician so your medication can be adjusted safely alongside your progress. This is not optional. It is essential. If you have kidney disease, heart failure, or any condition affecting how your body handles fluid and electrolytes, the dietary changes I described may also need to be modified. Again, bring this conversation to your doctor. Print out the references in the description below. Walk in with questions. A good physician will welcome that conversation. You now know what most people sitting in waiting rooms next week will never be told. You know that insulin resistance can develop silently for over a decade while blood sugar looks perfectly normal. You know the 12 signs your body uses to signal that something is shifting. You know the test that catches this 11 years earlier than standard panels. And you know the two changes: meal sequencing and a 10-minute post-meal walk that can begin reversing the damage starting this week. Do not let anyone tell you it is too late, because it is not. The body has a remarkable capacity to heal when you give it the right environment. Sandra is proof. My grandmother is proof. And the research from Johns Hopkins and the journals I referenced today is proof. If you made it all the way here, please do one thing. Share this video with one person you love. Your mother, your father, your spouse, your closest friend. Not because I want the view count, because insulin resistance is not a condition that announces itself. It moves silently. And the person in your life who needs this most is probably not looking for it. You can give it to them. Type "I finished" in the comments if you watched the whole video today. I read every single one of those comments. And next week, we are going to go even deeper. I am going to share the 5 worst foods for insulin resistance that are hiding behind health food labels. Foods that millions of people over 60 eat every single morning, thinking they're doing themselves a favor. You do not want to miss that one. Until then, do not let anyone tell you it is too late, because it is not. I will see you next week.